All right. Well, good afternoon, everyone. This is the first inaugural conference of HIMSS, and this will be a monthly 1-hour webinar, 45 minutes of questions. And this is going to be jointly done between Penn State University Health Informatics Program and the Northern Ohio chapter of the Health Information and Management Systems Society. So you'll be seeing information coming out about it on the Twitter account, or know him on the LinkedIn account, as well as on the website. We have with us today two people, and I guess the first thing I should do is introduce myself since I'm one of the two people. My name is Christine Hudak, and I have the dual responsibility of being the director of the Health Informatics Program at Penn State University, and I am also the current president of the Northern Ohio Health Information Systems Society. So I'm serving in two capacities here. Our second person we have in our presenter is Mr. John Paganini, and Mr. Paganini is currently the Senior Manager of Interoperability Initiatives at HIMSS, and his office is headquartered in Cleveland in the Global Center for Health Innovation, and they take up the entire fourth floor of the Global Center. Mr. Paganini has extensive experience in interoperability. He manages the initiatives, the operations, and the logistics of the new HIMSS Center. He is also the owner and president of Jaguar Informatics, an IT consulting firm. He has worked at Applied Visual Sciences, and he has also worked at the Cleveland Clinic. He is also a personal friend of mine and a past board member of the Northern Ohio Health Information Management Systems Society. So I'd like to also welcome Mr. Paganini, and I will turn it over to you, John.
Very nice introduction, Chris. Thank you very much.
Well, thank you. You deserve it.
Likewise. Hello, everybody, and welcome. And you're probably wondering, what is the Global Center for Health Innovation? If you haven't seen that building yet, it's a beautiful building in downtown Cleveland, connected to the Cleveland Convention Center itself. And so these two buildings combined really present some fantastic economical potential for the city of Cleveland with a very strong focus on healthcare. So as you probably know, HIMSS is focused on healthcare IT. So as you think about this building, the Global Center itself, it has different levels of the floors featuring showrooms of companies focused on patients, hospital infrastructure and services and products. So really the building as a whole presents a fantastic opportunity to look at the latest innovation in healthcare that spans many different areas. But as HIMSS, we, of course, as an IT organization, we want to work together with all of these companies to really bring interoperability capabilities to their systems, ultimately to achieve better health. As you may know, HIMSS has been around for 52 years, and they've been a lot, very influential and on human resources and financial commitments and thought leadership to, I'm hearing a lot of background noise there, they want to achieve really seamless and secure exchange of health information at the right time to the right people. So the goals of this center are to truly validate interoperability of health information and IT products. We want to educate all the stakeholders so they know how to use IT inside their healthcare systems and products. And of course, to bring communities together to solve common problems. So this is really, in essence, what the core focus and strategy of this center is. Right now we have 11 different, what we call collaborators, out on the floor. It's an exhibition floor, so to speak. We call it the Technology Showcase. And so we have a variety of collaborators out there, such as Allego Health. We have the Office of National Coordinator for Health IT, Fujitsu, Highland Software, IHE, ICSA Labs, Total Voice Technologies, Cardinal Health, Juniper Networks, Concur, and CDW. And so this is really the first wave, if you will, of collaborators who have in our grand opening 2 months ago, decided they wanted to participate in the HIMSS Innovation Center. And so we're actively talking with many other vendors in the healthcare industry for them to present their products and demonstrate interoperability up here on the floor. And when we talk about interoperability, we're really talking about things like HL7, DICOM, some terminology indexes like LOINC, CPT codes, ICD-9s, XML. So there's a lot of standards that actually are being supported and implemented here to demonstrate interoperability in the industry. So what I'll do now is, and we'll take some questions at the end of this. Maybe I'll just go through this presentation, give you an overview of what the center looks and feels like. And let me do this. First, I'm just going to start us off with some pictures because we had a professional photographer came in and took some really nice pictures and photos. So this is what we're looking at here is the technology showcase. This is kind of the entrance to it. You can see some of the booths that are there. And these different collaborators, the ones that I mentioned, have a booth area or maybe a kiosk. Right here, this is a picture of the welcome area. And one of the aspects is that these are touch screens here, so you can go up and have an interactive experience. You can't really see it on that screen, but this talks about the HIMSS value suite. And this is a walkway. This is what the building looks like. The HIMSS Innovation Center is on the 4th floor, but as you look down on this picture, you can see that Phillips University Hospitals, they have a showroom there. Below that, you can see Cardinal Health, and those showrooms are actually ready at this point. Although today, November 20th, the building is not officially open yet. It will be officially open in February. As you can see, there's some showrooms that are not yet finished and built out. So they're actively working on that, and hopefully we're going to have about a dozen new companies with their showrooms ready in February of next year. So the HIMSS Innovation Center is open. You just need to set up an appointment. There's just some more pictures of the building, and you can see it overlooks the convention center. On the right there, on the grassy area, is the actual convention center itself, 250,000 square feet of exhibition space, and there's been some great exhibitions here so far, bringing lots of people to the center and to Cleveland. This is just another booth, an organization called the Lego Health. And just some pictures of the showroom. So maybe that gives you a little bit of a better idea of what the environment is up here. So again, as I mentioned, there are 4 different levels of the building. Health and home on the bottom floor. There's going to be a medical home of the future. There's individual patients on the 2nd floor, clinical spaces, and for example, there's one company called Forvo that has intelligent floors so that when the patient gets off the bed and they're not supposed to, the floor senses that and can trigger an alert to the nurse, or if the doctor walks into the room and doesn't wash their hands, it triggers an alert. So it can really do some interesting things in a healthcare environment. So what we're talking about here is really just a little bit about HIMSS. It has a lot of leadership tools and resources. HIMSS is very big on providing education, webinars. They're a leader in interoperability standards and really harmonization initiatives and bringing people together with their systems. So our goals here at the Innovation Center are to solve real-world clinical workflow and financial transactional challenges. We want to be an international center of excellence for that. And if you think of the concept of the global center itself, it truly is the only one of its kind in the world focused on innovation in healthcare. We also help make sure that systems are compliant with regulations. We also work with stakeholders on health policies, and we inform and educate the policymakers themselves. So what's our value proposition? We want to help systems and companies enable their regulatory compliance We also offer the ability for these systems to come here to Cleveland and actually test their systems for interoperability and ensure that they are ready to go out into the world with their products and services and integrate with other systems. So they can come here and we provide them the testing tools. One of them is IHE's tool called Gazelle. Another one is the National Institute of Standards and Technologies. It's a government tool. And they can plug their systems in, do the testing, and at the end of that they can become validated and they really have a kind of a certificate that enables them to go out and let organizations know that they have done their testing and the integration in that particular organization will go smoother because they've already tested their systems in a laboratory environment. And that really, as it says here, it's a level playing field for the stakeholders. It enables companies of all sizes to ensure that their products work and play well with others, especially in the area of workflow and security. So we're looking towards bringing innovations with new and old technologies using provider use cases. And so there is here something called a simulation center, which I'll talk about. But a use case could be a scenario such as in radiology, has to exchange information in many different areas with the information system, the imaging system, the registration system, the referring physician. So there's a lot of different use cases in healthcare that can be demonstrated using these state-of-the-art testing tools, which affect businesses such as hospitals, health maintenance organizations, payers, governments, and consultants and vendors. So it really touches many different areas in healthcare. So what are some of the pieces? We saw some of the pictures. These were just artist renderings. There's a welcome center, a welcome theater, simulation, technology showcase, simulation center. So this is what the floor looks like from an overhead view. And you can see there's different sections. You can also see on the left-hand side is an expansion space, which is not open yet. It's about 10,000 square foot, which we're going to be growing into over the next year or so. So when you first come into the Innovation Center, you come off the elevator, and that red circle is around what's called our welcome screen, and it simply is an area where you can look and get a kind of a feel for the entire floor, but also you can look at the different vendors that are available in the technology showcase. And as you touch on the logo for the vendor, a video plays and gives you like a 1 or 2 minute video of what that vendor's products and services are and how they are innovative from a healthcare IT perspective. So this is the reception area. As you walk through the Innovation Center to the next area, there is a movie which kind of demonstrates why it's important for healthcare IT to be present and how that enables the right people to get the right information at the right time, and how healthcare IT is really moving the industry forward and some of the value that it brings to healthcare. So next to that is the simulation area, and as I mentioned, these are use cases, and it also can demonstrate some of the evolving standards and policies, and from a regulatory perspective as well, such as meaningful use. So how it is laid out is there is a podium. Let me go to a picture here. So there's a podium, which is a touch screen, and you select on that podium the different integration aspects of the use case that you're looking for. So in this case, you may want to, you might be the primary physician, you might be in the emergency department or the imaging department, and all of these play a role in the clinical scenario that's being described. In this case, as an example, it's just an emergency department encounter with an ICU inpatient stay with follow-up care. So in this case, as we're looking at this sample here, there's 6 different pieces of the puzzle, if you will, that require data traveling from one system to another system to another system. So this is the simulation center. And so that's the first screen showing that. Screen 1 is the description. The second screen shows what is happening actually at that point in the workflow with screenshots of the electronic medical records, some how the patient care devices might work, whatever that clinical scenario is, wherever you are at in that step of the phase is being described. And on the third screen, we're simply showing what the vendor at that point is in the workflow is showing. So it really is a nice environment from an interactive perspective to walk up to that screen and select your clinical scenario and the different integration points that you would like to see in that scenario, and it unfolds in front of you. So we are also engaging many different areas of healthcare, including communities such as nurses, physicians, pharmacists, payers, innovators, life sciences. There's many different communities that are being affected by this and also participating in the HIMSS Innovation Center. And it's really a good area to explore solutions that are collaborative in nature and not competitive in any stretch of the imagination. You will have all these different companies working and playing well together. Even though they may have competing products on the market, they still need to work together and send and receive information with each other. And that's really one of the great aspects of interoperability. So we have the technology showcase, and as I mentioned, this is where all the vendors, if you will, are located, and physically you can go see their booth. These are unmanned, and that is each of these vendors has touch screens, and their touch screen, when you go up to it, will maybe present a couple of different products and services, which you can touch a button and it'll reflect that particular product and service that you're looking for. Or if it's just one product, it may just be a video explaining exactly what they are doing in healthcare IT with respect to innovation. So each vendor, if you will, has presented and architected their own interactive demonstration and how they want to present their products and services. So as you're standing, at the back of the technology showcase, in a sense, you can kind of see how it's laid out at this point. We do have some new vendors, Highland Software and CDW and Cardinal Health. So they'll be adding their booths in the next month or so to the floor. And these are the ones that I mentioned earlier that are participating as of now, and we still have more coming. And so the meeting space is also a meeting room holding up to about 100 people, which breaks down into 3 separate rooms, complete with audio, video, and speaker system. And there's 2 different 65-inch screens on there, and there's a screen in the middle of the room that comes down. So it's a great state-of-the-art meeting environment in a sense. And so we've just begun to start hosting meetings here this month, actually. And so we also have for our collaborators a portal, and this portal allows the collaborators to actually receive lead information. So as people are visiting the HIMSS Innovation Center and they have an interest in their product or service, we are providing them that information electronically. We're also showing the collaborators what events are coming up, what healthcare conferences and seminars and exhibitions are here at the Global Center and the Cleveland Convention Center and at surrounding area hotels. And it's possible that these vendors may actually want to be present at their booth during these events while the people are up here visiting the technology showcase, which is certainly an opportunity for them to really be in person in front of the customer. So this is what the HIMSSinnovationcenter.com website looks like right now. And just to give us an idea of some of the conferences I just mentioned right now, and this is as of August, and this number has changed, but right now there's about 188 confirmed events. Many of those are, in fact, healthcare related. So as we look out into the future for meetings and conferences, trade shows that are coming. There's going to be a lot of people coming to the Cleveland Convention Center and the Global Center to visit our building here. So there's going to be an increase of number of attendees. So right now, I don't know if we've heard, but there is a new company who is actually taking over the Cleveland Convention Center and Global Center building as of this week, called SMG, and they are in the business of running convention centers. And so the city is very excited about this new opportunity here. So when you become a collaborator, there's different levels and there's different package deals for sponsorship in the floor. And so one of them is a founding collaborator, and that gets the 10 by 20 space on the floor. So again, it's just like an exhibition in a sense, and that the space is available to you to use as you wish, and you can build your own custom booth and messaging as you see appropriate. So really, that is the end of the presentation as I had prepared today. What we can do is open it up for questions if we like.
Sorry, I was on mute. John, I have a question, and it's about the use cases. Are the use cases taken from real life, or have they been developed in terms of, you have a developer putting them together?
Sure. What has happened over the years with HIMSS and IHE, actually, the organization, use cases have been developed, and there's dozens of them. And if you attend the HIMSS exhibition, the next one being in February in Orlando, there's always something called the Interoperability Showcase. Now, these use cases are really live demonstrations, if you will. So you may have that radiology example I gave you. You may have the electronic medical record vendor standing there at their workstation talking about how you might register the patient inside their system. And standing directly next to that person is the radiology information system. So the registration got sent to that system so that the radiology information system can start scheduling the procedure, the x-ray. And you might have standing next to that person the digital image storage for the x-rays, for the CT or the MRI. And then standing next to that person might be a system that represents the referring physician. So you really have four people standing there all talking about their system. And that is the demonstration, if you will. And that's live, and you actually see information going from one system to another in real time. So the simulation center kind of simulates that without having those people present. And those use cases are all predefined. Now, what we're doing in the technology showcase is we have a certain amount of vendors right now, all having different functionalities and features and interoperability capabilities. So we're kind of designing the use cases around what collaborators we have on the technology showcase floor. So we have a couple use cases already, and as we get more and more collaborators, those use cases will expand even further and further. For example, now that Highland is coming in, we're able to do more use cases in the with something called XDF, document sharing. So they will grow over time, but many of them have already been defined. But the concept is to highlight these collaborators that are in the showcase, what their interoperability capabilities are. So we're designing the use cases more so towards what their capabilities are.
I have a couple of students that are viewing this, and they better keep trying to ask questions, so I will ask. One of the things that we've been talking about in our classes here with our students is the role of the federal government and the Office of the National Coordinator in setting the standards, and the role of HIMSS in setting the standards. And the question becomes, is this a collaborative effort in terms of setting standards for interoperability, or are we going with International Standards Organization, or how do those standards come about?
the standards were started initially. Well, let's think about the definition of the word standard. HL7 in itself is a standard. Just like XML in a sense is a technical standard. It's a way of formatting and the protocol of the data itself. So what organizations like IHE has done, which was really set up by and for and from the vendors themselves, who had a vested interest, if you will, in making sure their systems all worked well together, so that if you had vendor A in an organization and vendor B and vendor C, that when they needed to send and receive information, it would work. And so they took the existing standards like HL7 and DICOM and other standards and created a technical framework around that. And then that was being guided, if you will, by HIMSS at the time. Simultaneously, the government was also doing some of their own standards generations in a sense. And so over time, those organizations, that is HIMSS and the government and IHE and other organizations, are kind of coming all together to create overall standards that work throughout, in a sense. And so they're not being done without the other one knowing about it. They're all kind of working together. And so that is why the Office of the National Coordinator in healthit.gov is really present in the HIMSS Innovation Center, because we are all working together in a common interest to move these standards forward.
But this seems to be a premier example of a public-private collaboration. Whereas, in as much as HIMSS itself is private, because obviously it's a membership organization, but this seems to be something that could be used as an example in everything in health IT, from certifying medical records to, I'm going to bring up something that nobody wants to hear about, but ICD-10, to actually engage the professional organization with the government to set the standards, and then leave it up to the vendors to look at that. But what you're bringing together the organization, the vendors, as well as the federal government to set the standards for health IT.
Yes.
And I guess the question that comes from that is, where do we see this going in 5 years, 10 years? If everything talks to everything else, interoperability will no longer be an issue, or will it? That may be loaded. That may be loaded, but if
it's a difficult question to answer.
Yeah.
I mean, certainly we can see, and since I've been participating on IHE since 1999, I've seen a lot of maturity, if you will, in the aspect of interoperability, but the standards continue to change architecturally and technically in the industry, and so it's hard to predict what's going to happen in the next 5 years, but I think we are absolutely on the right track as where we're going. As to where it goes and where it sets in 5 years, I am positive that it is going to be better, and it's going to continue to have these systems, have the interoperability more built in, more standard as we move forward. I also think that, personally, I think meaningful use is really helping to evolve the industry with those standards by bringing organizations closer to being fully electronic and enabling them to share information.
One of the things that particularly interests me, and this is now a question to you, most of what we've seen in interoperability has focused on the inpatient experience and the experience in the doctor's office, and integrating all of that across the enterprise. Is the Innovation Center doing or going to do anything with the mess that is known as public health informatics? Because, for instance, you have the CDC and you have the NIH, both of which have databases of practically the same information, and they don't talk to each other. So if I wanted to do information on surveillance research, for instance, I would have to look at the data from CDC in one way and data from NIH in another, and to be able to combine those data sets together would require me to do a normalization of data that would actually lose a lot of the value. So just the short question is HIMSS going to get more involved in public health informatics and bringing them into the fold?
I can't speak to that as a subject matter expert, Chris, but I do know that we, of course, have the HIMSS Analytics division of HIMSS. As to whether they have taken CDC and NIH and brought those data sets together, I don't know, but I certainly want to look into that. We do have a population health initiative within HIMSS as well, which I'm sure somehow, and we're talking about how that makes sense at the Innovation Center right now as we move forward. So I see that happening, yes. And especially with the thought that there's a consumer health aspect of that, which I think is very interesting to the public who is actually coming off the street, because this is a public building. So we want to offer the public some interesting areas, such as, is my data secure, or what is a patient portal all about? Those consumer items that everybody is hammering to find out about.
Absolutely. So one of the reasons I'm asking is that we're putting in place, and this is a shameless plug, but it's necessary to ask for you to know why I'm asking the question. We're putting in place a program where students can get a certificate, a joint certificate in public health informatics, and it's a collaboration between our School of Public Health here and the HI program. And one of the things that we're seeing right now in the literature is that whole public health, population health piece is becoming very, very important, because everybody's saying, well, we've got all the systems in hospitals right now, and we've got the implementation. Now we have to figure out what to do with the data. In the public health arena and population health, it's completely different. We have all the data. We don't know what to do with it. And that's why I'm particularly interested, because public health informatics is one of the areas I'm very interested in. So it's good to know that HIMSS has a population health innovation.
Yes, and I don't foresee that there's going to be a lack of which questions can we ask of that data now that we have it.
Right, because that really is going to be an issue. One other question I have, and the only reason I'm bringing this up is I have heard this, and I sort of wanted your reaction to it, and I don't mean to put you on a hot seat, because if you choose not to answer, you don't have to. And one of the things that has, I'm asking, one of the things that has been said about the Interoperability Showcase, as well as the HIMSS Innovation Center, from the naysayers who can't go beyond, these people have products to sell, is that this isn't so much talking about interoperability and innovation as it is talking about which companies have enough money to sell their products. Now, I personally think that that's a very, very narrow view of what the center can do. And I think that when people look at that kind of, or make those kind of statements, they don't realize the potential to put records together. But I think it's a criticism that's been labeled, and I guess I just sort of wanted to get your take on it.
Yeah, well,
I heard that last year when I was with him.
I hear that statement. I don't. I'm just going to say that this opportunity for companies to demonstrate their products and services here on the Technology Showcase is in my mind, the greatest opportunity that these companies can have to show how they're contributing to healthcare IT innovation. It levels the playing field, so you don't have to be a big company or a small company. And in here, there's different sponsorships, so you still have a presence here. And demonstrating interoperability is a very powerful aspect of the features and functionalities of your product and service. So I hear that, but I don't see it. I think this is a place where you can see which products are out there. And if you think about Dr. Cosgrove's initial vision of this building, that is the Global Center. The Global Center was a place where he said, geez, I wish I had one place I could look at all the different products and services for my hospitals. And so that was the initial vision of the Medical Mart, which is why it was called the Medical Mart back in 2008. Here we are now in 2013. We have the Global Center because it truly is the only one of its kind in the world for health innovation. And yes, there's products and services in this building, but what a great opportunity for people to come and look and kick the tires and pick and choose between the different vendors and solutions. It's a phenomenal concept. One which I believe in wholeheartedly.
Well, I heard that a lot last year when I was at HIMSS 13 and I went to the Interoperability Showcase. And I think it was people who didn't go into the Interoperability Showcase to see what the capabilities were that were leveling that criticism. But I think that you are absolutely right. It does level the playing field and it brings in the vendors. Because regardless of whether you like it or not, the government can't do this. They can't build the systems. They can't build all the interoperability without the public-private collaboration. But I thought it was sort of an interesting take on the center. And I agree with you. I don't hold that view either. I think I'm looking at it as an incredibly powerful place to prove that health informatics and health information technology really does have a place in modern medicine, and that we can make a big difference in quality taken care of.
Absolutely, and it's a very much an educational aspect of it as well. While we're bringing everybody together to solve these problems.
I have one last question, and that's about the consumer informatics aspect. So if I'm John Q. Public, and yes, this is a public building, I'm going to be intimidated as anything to walk into that building and to walk into something called HIMSS Innovation Center when I don't even know what HIMSS means. So how are you going to get the public engaged?
Well, it's an interesting journey if you think about this building. And so I'll think about it synergistically, if you will, or holistically. As that John Q. Public walks into the building, they go into the welcome reception area on the first floor. They walk into the medical home of the future, which shows them all the different interesting, innovative technologies that are going to be in the average home and in the present and in the future. Then they walk up and they see what life as a patient is, and they go to GE's booth and they see the disease journey of breast cancer, and they go to the university hospitals and Phillips, and they see that demonstration of radiology and imaging, and they go to Cardinal Health and they see products and services, etc. And then they come up to the HIMSS floor and they see how information technology kind of drives and supports and is the core infrastructure behind that innovation that really enables this healthcare to be in the right place, to the right people at the right time, and they see some examples of that. But also I mentioned the consumer aspect of it. There will be some consumer friendly, and certainly we're thinking about the average consumer up here on the floor as we present our marketing, in a sense, our messaging, and how we communicate that. So we will not be too technical in that sense, and they will see the value of IT.
See, I think that's an incredibly exciting piece of the Innovation Center and of the Global Center for Health Innovation. But you can walk in, and I think this is something in terms of education of the public that, you know, people need to know about it. Now, the whole, everything's not open yet, so obviously people aren't going to be coming in, but I think once information gets out and somebody can say, okay, what is it like? You know, what does it do? I think you will be seeing more people. I can only hope that you get more consumers in there and less technicians. Of course, the technicians are the ones that have the money to buy the stuff. But
Sure.
I think
be
it's an
both
exciting
audiences.
time to have.
There will be a yeah, I do too, and thank you for saying that. But there will be both audiences. Certainly, there will be technical people. There'd be there are high-level administrative people. So there are going to be all the potential audiences one could imagine are going to be here. So that is a challenge. How do you architect a message that is you know, talks to every single aspect? And so you know, we're working on that.
Excellent.
Yep.
Well, my students that are here have seemed to be questioned out.
Okay.
I don't know if anybody else on the call has any other questions. I would like to thank you for being our first inaugural speaker for our series, and we would like to have you back on your anniversary next year to do another presentation to tell us what's been happening.
Yeah, I think an update, a yearly update would be great. Yep.
We would definitely put you on the schedule for next November, so you can come and give us an update about the center. And
I feel a field
trip
maybe in the future too. Yep. And don't forget, there's always a field trip option.
I think a field trip is in my future, except I can't afford lunch for all my students, so we'll have to come in the afternoon because I'm not buying them food downstairs. All right. Again, John, I want to thank you for giving us your time. I know you're busy.
Sure.
I know there's lots of stuff going on. And one more time, there's a meeting for youth conference December 3rd. And again, it's very small, but there are some things going on. And I urge everyone who's on the call to go down there, go bother John, look at the HIMSS Innovation Center, and make them work. Thank you so much, sir.
All right, Chris. Thank you, everybody. I appreciate your time.
You're welcome.
Bye-bye.
Bye-bye.